Hi everyone, this is Feleciano Rosil III, a respiratory therapy student, and I'm going to do a return demonstration about arterial blood gas analysis. So arterial blood gas analysis, it evaluates gas exchange in the lungs by measuring the partial pressures of oxygen, carbon dioxide, and the pH of an arterial sample. PaO2 indicates how much oxygen the lungs are delivering to the blood, while PaCO2 indicates how efficiently the lungs eliminate carbon dioxide. The pH indicates the acid-base level of the blood or the hydrogen ion concentration. A blood sample for ABG analysis may be drawn by percutaneous arterial puncture or from an arterial line. For the first procedure, do hand washing. It reduces the number of microorganisms residing on the surfaces of hands. Next is to read doctor's order to obtain pertinent data. Next is to instruct the patient regarding purpose, procedure, and responsibilities, because information may alleviate hyperventilation that, when patient is present, might alter arterial blood gas values. Assuming that I already explained that arterial blood gas values monitors oxygen, carbon dioxide, and the pH of the patient. Select site, so I chose radial artery. So radial artery is used as a first choice except in the case of multiple radial artery punctures, hematoma, occlusion of ulnar artery, history of circulatory impairment to extremity, or cardiac arrest. The radial artery is a small artery, however, it is easily stabilized as it passes over a bone groove located at the wrist. The percutaneous puncture and pressure control are enhanced by anatomical landmark. Perform the Allen test or modified Allen test, or use a Doppler instrument to determine ulnar and radial artery patency. This collateral circulation to hand is provided by the ulnar artery. The Allen test assessed for ulnar artery patency. Now, position the patient. Since I choose a radial artery, use semi-recumbent position. Elevate and dorsiflex patient's wrist slightly using a small pillow. Dorsiflexion of the wrist moves the artery closer to the skin surface, making the artery easy to palpate. And next is to prime syringe and needle with heparin, leaving only enough heparin to fill the syringe. Priming the syringe with heparin prevents specimen coagulation. However, any heparin in excess of that needed to fill the dead space will lower the pH and PCO2 of arterial blood. Next is to eject all the bubbles from the heparin. All air must be ejected to maintain accuracy of blood gas values. Prepare the site and fingers used to palpate site, and cleanse with the selected site in circular motion outward with povidone ion prep swabs and allow to dry. Drying of povidone iodine solution reduces risk of local infection or systematic sepsis. Clean site with alcohol swab and allow to dry. Alcohol removes povidone iodine coloring from site and thereby increases visibility, and puncturing through a moist, alcohol-prepared site can increase pain. Perform percutaneous puncture of selected artery. Locate the pulsating artery. Stabilize artery by pulling skin taut and bracketing the area of maximum pulsation with fingertips of free hand. Puncture skin slowly, holding syringe like a pencil. Advance the needle slowly with bevel upward and approximately a 45 to 60 degree angle to radial artery. A gradual thrust will promote arterial entry without passing directly through it. Enter at angle comfortable by stabilizing your hand. Certainty of position is more important than entry angle. Observe syringe for flashback of arterial blood. It verifies that the artery has been punctured. Flashback occurs readily with a glass syringe. Gentle aspiration may be necessary with a black syringe. If puncture is unsuccessful, withdraw the needle to skin level. Angle slightly toward artery and re-advance. Obtain a 1 to 3 ml specimen because this amount allows for rechecking and additional studies if necessary. Withdraw the needle while stabilizing barrel of syringe. This prevents inadvertent aspiration of air during withdrawal when using a glass syringe. Apply firm cutaneous pressure to arterial puncture site for 5 minutes or until the bleeding stops. Hematomas following an arterial puncture can cause circulatory impedance, discomfort, or can dispose to infection. Apply firm pressure for 10 minutes if the patient has a history of increased coagulation time. Apply ice pack to help persistent bleeding. Next is to protect blood sample. Hold syringe upright and express air bubbles rapidly. Air bubbles may alter laboratory test results. Seal the needle immediately using a rubber stopper or cap. Specimen must be kept airtight to prevent alteration of test results. Next is to roll the syringe gently to mix the blood with and heparin. Immerse blood sample in enough ice for transport and laboratory. The use of ice reduces temperature of the sample to below 4 and slows the metabolism of oxygen. A delay longer than 2 minutes alters values. Label specimen and complete appropriate laboratory requisition. Note that the percentage of oxygen therapy if applicable, the temperature, especially if elevated, and the time specimen was drawn. Specific information related to sample collections enhances accurate analysis of results. Lastly is to expedite immediate laboratory services. No test results for any specimen, even if chilled, can be accepted as reliable if sample is tested more than 50 to 30 minutes after arterial puncture. That's it for my return demonstration. Thank you for watching.